Good morning, sir. Sir, myself Darul, and today I am going to present a 19-year-old female, namely XYZ Kadri, who is the resident of Gaunpur, Baramulla, presented to this hospital with the underlying medical illness. So she belongs to the upper middle class income group and admitted on 20th May with the chief complaint of pain behind sternum since from past 5 days, shortness of breath from last 3 days, which is also associated with palpitation and restlessness. So now I'm presenting the history of present illness. Patient was in the usual state of health when she started developing sharp throbbing pain behind the sternum, which was sudden in onset and aggravated with restlessness and while performing some respiratory muscles movement. So this condition was relieved by lying on the bed or by performing some breath holding techniques. Patient also complained of shortness of breath, which was acute in onset and progressive in nature, which is also associated with mild fever. Sir, palpitation also seen in patient with sinus tachycardia, which was relieved by taking some beta blocker like propranolol and some other antidepressive drugs. So there is a negative history of cough, vomiting, or any other history of trauma to the chest or any other organ. Sir, now I am going to present the past history. Sir, there is a similar condition seen 2 months back, which was milder than the present illness, and she took treatment from the local area hospital according to her statement. So she had done a surgery of tonsil, surgery of legs in the past year, and also there is no any history of tuberculosis or any other cardiac illness in the past. Now I will present the personal history. So she is a first year computer science student and she is non-smoker and also she has no addiction to any other substances. Her food habit was not at a satisfying level as frequent loss of appetite occurred due to the post-traumatic stress disorders. So there is also a finding of iron deficiency anemia in her CBC report. So she belongs to the upper middle class income family as per a Scoposwamy scale. Now I am presenting the family history. So she has lost her father 2 years back and the cause of the death was brain trauma with hemorrhagic shock. Treatment history. So she is currently on intercostal chest tube drainage or ICD. She is also taking analgesic drugs for the pain relieving in accompanied with oxygen therapy. Psychological history. Her GS scale is normal, well oriented on time, place and person. And she looks much anxious due to the post-traumatic stress disorders and current respiratory illness. At last, I am presenting the menstrual history with other important clinical sign. So she has a normal menstrual cycle with menarche attained at the age of 13 years. Her VBG report shows that pH 7.31, which is mild acidosis, PCO2 44 mm of mercury, and partial pressure of oxygen 31 mm of mercury, which is the indication of hypoxemia. Sir, her sodium level is normal with 136 millimole per liter and potassium level low, suggestive of mild hypokalemia. So her blood pressure is 100 by 60, her pulse rate is 140 beats per minute and SpO2 level is 91%. Thank you, sir. That's all my presentation is. Thank you.